on the topic Yoga for Nursing Students, Rationale and Psychophysiological Benefits. Very happy to be representing the Center for Yoga Therapy Education and Research, CITER, under the Faculty of Allied Health Sciences, Shri Balaji Vidyapeeth. We had the good fortune in training the nursing students, which was the main rationale of the study. Health professionals, especially of the nursing cadre, are under extreme pressure from patients, caregivers, doctors and the hospital authorities, and they require high levels of professional competency, resilience, as well as the ethical and compassionate behavior. Yoga has the potential to facilitate all the aspects of the human development and hence can develop these attributes through the attainment of the physical, mental, emotional and spiritual well-being. Bi-weekly yoga training sessions, 60 minutes per session, was imparted to 60 students of the BSc Nursing course for 6 months in collaboration with the Kasturiba Gandhi Nursing College of our university. Introduction to the theoretical aspects of yoga and yoga philosophy was given as part of the training. The practice sessions comprised of jatis, the loosening practices, kriyas, the breath-body coordinating practices, Surya Namaskar, the sun salutation, asanas, a few of the postures where you're stretching or whatever, holding the position with normal breathing, and the pranayama practices, which are techniques where you will be extending and expanding the dimension of your energy techniques and relaxation. Selected biochemical and hematological parameters were recorded before and after training period, along with the Ferenc and Powell's quality of life index that was recorded before, in the middle and after the training period. And this was part of the core curricular activity of the nursing curriculum, and so we were not able to have a separate control group, and to get rid of the extraneous factors, we correlated all the findings, all the results with the attendance, individual frequency of their attendance. The results we obtained are tabulated as follows. The results mainly, the post-intervention statistical analysis done by repeated measures ANOVA revealed highly significant and beneficial changes in most hematological and biochemical parameters. The major findings we came across were enhanced bone marrow function, which was evident with a significant increase in the hemoglobin levels, reduced allergic tendencies, where we also found that the eosinophil levels came down, alkalization of urine, metabolic reconditioning, and improvement in the quality of life indices. Again, a positive correlation with the frequency of attendance done by the Pearson's linear correlation of testing. This was what we came up with as per the suggestion given to us during the valedictory function by our Vice Chancellor, Professor Sethu Raman sir, to conduct the avant-après comparison. And we came up with this. Such a remarkable change was found with all the students' remarks as to what they were before and what they were feeling after the 6 months of training. A few clips from the training period. So the discussion, these health promoting changes may be attributed to all the following points. Mainly we had an integrated schedule consisting of the Surya Namaskar, asanas, pranayama and relaxation practices. As we always know, Surya Namaskar is known to improve the metabolic activity, as also supported by many other studies, and several studies also talk about from the responses, the healthy responses from the lipid profile that we had, where we had a significant increase in the HDL and a significant decrease in the LDL and the VLDL values, showing positive changes in the cholesterol ratios also, which again proves the anti-atherogenic effect of yoga. And a few other studies have also quoted the decreased cardiovascular risk profile by decreasing the activation in the sympathoadrenal systems, as well as by decreasing the activity of the hypothalamo-pituitary axis. adrenal axis by enhancing the parasympathetic tone via the vagus nerve activation. And in our study, we also found positive sense of well-being that was indicated by all the quality of life scores that were found. In all, the subscales were significantly improving. The subscales, namely the health function, the psycho-spiritual function, family, and the socio-economic subscales. All of them were found to be significantly improving, both during the mid-period after 3 months of the training as well as the post-period after 6 months of the training. And yoga seems to be having a good effect on improving the neurohormonal mechanisms, thereby increasing the secretion of melatonin, which is a direct marker of the sense of well-being in us, in the individual. We also gave the pranayama practices, which has a direct link on the limbic system, where controlling the emotions or stabilizing the emotions we can see, as well as the nada pranayamas that we did with them, where we brought in the nadas such as the omkara, the akara, ukara, and the makara and the omkara sounds, which helps to get rid of, sublimate their regressed and suppressed emotions also there. So thereby there is a sense of calm, peace and tranquility that is being enhanced in the students. They are more confident also with the help of all the practices that we were doing. Last but not the least, the relaxatory practices helps in healing as well as helps in connecting and reconnecting themselves, as well as integrating and reintegrating themselves at all the levels of their existence, namely the physical, the psychological, the emotional, the spiritual, and in the other layers also. In view of all this, the present study provides evidence of beneficial psychophysical effects. We suggest that yoga be made an integral part of the nursing education as being done at Sri Balaji Vidyapeeth. Every seed has the potential to grow into a plant or a tree, and yoga practices definitely enhance the potentiality of every student to manifest and become the best. So, thank you for the opportunity given.
It's an excellent presentation, Ms. Meena. The question is